Hello, I'm Susie Cooper. I am going to demonstrate how I would examine the knee. I've got my willing participant here, Mike, who is very kindly agreed to let me examine his knees. Mike has no pain in his knees, is that correct, Mike?
That's correct.
And he's no previous pathology of his knees that we're aware of. So I'm going to examine the right knee. Obviously one would always examine the left as well to compare. So Mike's in no pain at all today, are you?
No.
And he's well. So I'm first of all looking at his knee. One would inspect it. One would inspect both the legs. You're looking for any obvious asymmetry, looking at the feet, the ankles, looking for obvious swelling, scars, changes in the skin around the knee, loss of hair, loss of muscle bulk, and looking at him generally, he looks well. There's no obvious asymmetry. I'm now going to palpate the knee. Before I go on though, it's worth saying that I would have obviously watched Mike walk into my consulting room, so I've already got an idea about his gait, but for the purposes of this, we'll do that at the end. So I'm looking at the knee and I'm now actually going to palpate it. I'm just going to feel the knee and make sure that there is, tell me if it hurts at all, Mike, there's no obvious swelling around the knee. I'm feeling around the patella itself, gently going to move the patella. It moves nicely, it doesn't move overtly so, and it certainly doesn't dislocate, which if it did would be extremely painful for Mike. Feeling around the patella itself, feeling the patella tendon and the insertion on the tibial tuberosity, which of course can be swollen in things such as Osgood Schlatters. Clearly Mike's the wrong age group for that. Feeling Gurney's tubercle and for the insertion of the ITB, and feeling up the side of the leg for the ITB iliotibial band, which in him is not at all sore. Superiorly feeling quadriceps tendon, and as I'm doing all this I'm feeling for heat, and I'm also feeling for any swelling at all around the knee. I can brush down. Usually it's fair, even one doesn't need to do that to see that there is any swelling. If I really am worried that there is swelling, you can demonstrate it with a patella tap. One would push the fluid down, milk the fluid down, and then gently tap on the patella, and one would elicit a feeling of a tap behind the patella. There's clearly no swelling there at all. Feeling behind the knee as well, swelling in here, for example, as one would get with a ruptured Baker's cyst, particularly in osteoarthritis, and feeling the integrity of the hamstrings and the calf as well. Now I'm going to ask Mike to move the knee himself. So active flexion, if you could just bend your knee, Mike, as far as you can in, that's lovely, and straighten it again. There's clearly no pain when you do that at all. I'm now going to move his knee myself, feeling all the time, for example, if I can ask you to bend it again, I'm going to bend it as well. Crepitus in the knee, and then straighten, relax, and I'll move it now. And crepitus in the knee, and see the range of movement, which as you can see is full. While I'm here, I'm just having a look at the foot as well. I now like to examine his hip as well, because hip joint integrity is extremely important. Because a lot of hip pain may present as radiating down to knee pain as well, causing knee pain, as can that in the lumbar spine, which we'll come on to. So I'm just going to lie right back on it. Just going to come back. And if I can ask you to lie down on the couch, lovely. While he's lying there like that, this is a good time to examine the hip. So I'm just going to have a look at his range of movement in the hip. There's no pain. It's nice, smooth knee hip examination, and certainly no stickiness there. And while I'm here, I'm also looking again for any hyperextension, recavatum of the knee. I'm now going to bring his leg up for a straight leg raise. Mike, does this hurt at all when I do this? No, he's clearly got, and I do the other side as well. So that will be a good test, just making sure that there is not an impingement in the of the sciatic nerve. I'm going to bring you back up here, Mike. So his range of movement's excellent. I'm now going to just make sure that neurologically he's intact. So if I can ask you, Mike, first of all, to lift up your leg straight, and I'm going to stop me pushing it down. One would obviously compare with the other side. Good. And then bend your knee and bring your heel into your bottom for me. Pull, pull, pull. And then kick me away, extension. And then just complete toes up towards you and toes down. And resist my hands this way and resist outwards. Good. So that's full muscular testing, obviously comparing with this side of the lower limbs. And I'm now going to, apart from, of course, sensory testing. So I'm going to just, can you feel me touching you here?
Yeah.
Here, here, feels the same both sides?
Yeah.
Here?
Yeah.
Good. So he's intact neurologically. So we check power, we've checked the neurology, we've checked the range of movement. The next thing to do is a little bit of special testing before I get him to stand up. So the first test I'm going to do is the anterior draw test. So I'm going to ask him to bend his knee and sit on his foot very slightly. And I'm going to gently but firmly as well try and elicit the anterior draw test, of which of course is negative, and the posterior draw test. He's certainly not obviously lax there. Next, I'm going to check for the collaterals. I'm going to ask him to let the leg relax, put him in 30 degrees, and first of all, I'm exerting some varus stress, testing for the lateral collaterals. Now I'm straighten the leg, do the same again, that's entirely intact. There's no gapping there in the lateral collateral, in the lateral knee. Again, 30 degrees, this time we're feeling for the medial. And again, I'm feeling for gapping as I do that when I exert valgus stress. Same with the leg in extension, it's entirely intact. So all in all, we've got an intact knee there. There's only one more test to do here, and that's the McMurray's test. I'm going to ask him to bend his knee, put it into flexion. I'm just trying to track the meniscus. Now, might you tell me if this hurts at all? I'm feeling for a pop as I extend the knee. I felt a bit of one there. Does that hurt at all? No, in the lateral meniscus, and the same laterally. No pain there at all. And his, as you can see, that was not painful at all. Can be a very uncomfortable test to do, and that certainly wasn't. His knee appears intact. So only one more thing to do, really. I want to get him to stand up, walk, and then, if we could do that, and have a look at him. So first of all, I'm asking him to stand still, which I would have done at the beginning, obviously. We're checking to see, his knee, is he aligned? He's actually got, he's pretty straight, really. He's got a good alignment there. Can you go up on 2 toes for me? And down, then good. And then if I can ask you to walk towards us here. Good, his gait's good, and then walk away from us as well. Good. He's got a really essentially very normal knee examination. Thank you very much, Mark.
Thank you.